Robert Murphy, professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning. Monday morning.
Yes, Monday morning. We got that correct here. So as you know, the president had 2 episodes of hypoxia where his oxygen levels were way down. They made the decision to give this steroid called dexamethasone. Why was that a significant decision?
That's a huge decision because that's only given in very advanced COVID disease, and it's given late in the stage. So he must have really desaturated his oxygen, and then they put him on it. The thing with dexamethasone, any high-dose steroids, for anybody out there that has ever taken a high-dose steroid for a short period of time, it's really mentally very challenging. It causes all sorts of mental issues, including delirium.
So what about the reports that he might be released as early as today? That seems to conflict with the seriousness of what that drug implies.
Well, you know, the doctors are the doctors. They've got to, you know, they make the decision. Don't forget, he goes back to a place that has an ICU in the basement and a full-time doctor at his bedside 24/7. So it's not like he's going home like you and me are going home. But, you know, so that has to be taken into consideration. I think for somebody who's still on steroids, I think it's premature. I would think it's premature, but I don't know the exact details. So it's up to the doctor.
What can you tell us about some of the other treatments he's been receiving? What do you know about this experimental antibody cocktail that was developed by this drug maker Regeneron?
Right. So he's received 2 approved medications, remdesivir, which is made by Gilead, antiviral drug that has never shown to improve survival, but it does cut the symptoms of the disease shorter, and that's why it got approved. It's given intravenously for 5 days, once a day. The other one, he got dexamethasone, we just talked about it, the steroid, which is given very late in the course of the disease to prevent, you know, full respiratory collapse. And it works best if you're already on a ventilator. There, the difference in survival is really quite dramatic. Then he also got the Regeneron monoclonal antibodies, which are not approved and have been treated in relatively few number of people. And this only works early in the course of the disease. And if you have not already developed your own antibodies, when you're exposed to the virus, you develop antibodies. What the Regeneron thing does is give you the antibodies right up front before you even have to make them.
What
so
about
all over? Nobody's ever done what he's received.
A new study says 82% of COVID-19 hospitalized patients have neurologic manifestations. What does that mean?
That means that this is a disease that has long-term consequences mentally, neurologically and mentally. For instance, there's been a lot of writing about Boris Johnson, the Prime Minister of the United Kingdom. You know, he was in the hospital with COVID. He was in the ICU for, I think, 3 days, and he got out. He was a different person, and they are now saying that, you know, he's a little kind of off a little bit, a little slightly lethargic. He's normally a very bubbly, effervescent type person, and he has definitely slowed down. I don't know if it's from COVID or is something else, but that's just an example of what can happen. So it's just 82%. It's very common.
Let's get to a couple of questions, Dr. Murphy, starting with this. If I travel to a quarantine state and test negative when I return home and confirm no other exposure aside from travel to the quarantine state, why must I self-isolate for 14 days? Work requires travel, and this requirement is increasingly difficult to manage.
Because otherwise, if you don't quarantine for 14 days, you're going to have another White House, although it's not going to be the White House, it's going to be your house. You're going to be, if you pick something up in a quarantine state, the reason why it's a quarantine state is because things are way out of control, way more than in Illinois, which is relatively stable. So unfortunately, that's what happens in a pandemic. If you want to be safe, that's what you do.
All right, next question. Should we be concerned that Moderna has never brought a drug to market?
Well, there are people that work at Moderna that have gotten drugs onto the market. They're getting a lot of external advice. You have to start someplace. So I think that they have enough advisors on board to actually do this the right way. One of their big partners is the U.S. government, is the NIH. So I think there's going to be a lot of help giving to Moderna. They have a lot of challenges. You know, this is the first RNA vaccine. And, the cold chain supply, we talked about this a little before, you have to keep everything super cold before it gets out into the retail area, so to speak. And that's going to be a big challenge. But they're working on that now. I think it's doable.
All right.
Time for one more question. Has there been any updated research that shows how COVID affects children 2 years old and younger, especially newborns and infants? What would be the guidance you would give to families with babies?
Well, fortunately, in this disease, the younger you are, the milder the symptoms or no symptoms. They get it, but they tend not to really get so sick. Now, I've said that, and there have been a few very young children who've gotten sick and very few who have died from it. It's more dangerous to have the flu at that age than it is to have coronavirus. So it happens. But it is typically a very mild disease. But, you could be one of the outliers, so you have to be very careful. If you have a kid who gets coronavirus, you have to have a good pediatrician at hand.
All right. If you have a question for Dr. Murphy, go to our Morning News Facebook page, post it there. We'll talk to him again tomorrow. Thank you, Doctor.
Great.